I want to reiterate the thank you for coming back after lunch on this beautiful day, because we do have a panel of very distinguished speakers who is going to remind us exactly why school food plays an important role in child health and well-being. So this next hour will be devoted to an overview of the current state of child hunger and nutrition, understanding the role of reducing child hunger and improving child nutrition to optimize health and development, and to discuss how policy impacts child development and well-being in schools. Our first speaker is Catherine D'Amato, President and CEO of the Greater Boston Food Bank. Under her leadership, last year, the Greater Boston Food Bank distributed enough food to feed more than 500,000 people in need. So we're very excited to have Catherine here to speak to us about the thin line between kids and hunger.
Thanks, everyone. I want to applaud you all for coming back in as well. That was really tough. I do want to recognize we have a lot of folks here from the food bank sitting up here. There are 4 folks. If you have any questions about food banking, ask them. They're terrific. My point today is to begin to just take a few minutes to frame what it looks like, what the issue looks like around hunger, and in particular hunger in Massachusetts and among children. And we have some very esteemed other members of this session to be able to really share both the science and the application of that and what actually occurs and why it's such a thin line between kids and hunger. So when we look at hunger in America, it's very much defined as food insecurity. And many of you have grown up with the word food insecurity. Some of you are familiar with the word food security. Both exist. For the purpose, though, of this, we're looking at food insecurity. Without daily access to nutritious foods, individuals cannot actively live healthy lives. So hunger here is a broadly used term. Measurement of food deprivation. USDA defines food insecurity as that consistent access to adequate food being limited by a lack of money or other resources at any time during a year. Today, 1 in 6 Americans are food insecure. And in Massachusetts, for children in particular, well, it's 1 in 8 in Massachusetts and 1 in 4 for children. The U.S. Census and USDA reports showing that food insecurity among children in Mass has doubled in recent years, from 8.8% in 2000 to 16.6% in 2012. So the issue of what's going on in our schools is deeply, deeply important. There are about 118,000 food insecure kids in Massachusetts. And at the end, I'll show you a map of Massachusetts, and you can see how your area what your area looks like. So there are many causes to food insecurity, and much of what occurs can cause that child's life to be in huge jeopardy and is deeply connected to the family unit that they're in as well. So when we look at these numbers, again, 1 in 8 in Massachusetts and 1 in 4 for children, let's also begin to look at the why. And there's a lot of trade-offs that occur in the communities that we serve across Massachusetts. And hunger is not something you can walk down the street and say, this one's hungry, that one's not. It's a very invisible but a very powerful epidemic in our country. So if you look at these trade-offs, when families have to make this decision with limited dollars, food becomes a trade-off. The good news is that there is a very robust emergency feeding system in Massachusetts. So that helps a lot in terms of families being able to go to a food pantry in their neighborhood or seek some other food assistance. But look at these trade-offs. Families, 61% are trading their food money for utilities, 60% rent and mortgage, 60% medical care of the time. Transportation runs about 52% of the time. Education, 31% of the time. And not surprising because they're often working adults in these families. Daycare is an emerging expense for trade-off as well. Do you pay your $1,000 daycare bill per month, or do you feed your family? So you're going to probably pay your $1,000 a month daycare bill. So parents make a lot of tough choices every single day. The food bank system, along with many of you in this room, many nonprofits that do really critical work in fighting poverty across the Commonwealth, fighting hunger, et cetera, have very innovative, exciting, useful programs that are trying to address this population across the Commonwealth. But I wanted just to share the food banks, and there are 4 in Massachusetts. Western Mass Food Bank has the 4 counties in Western Mass. Worcester County has Worcester, and then Greater Boston has Eastern Massachusetts, but then we also have Merrimack Valley up in Lowell as part of that system. We are a system. We try to work together. USDA, which comes through, this may not make sense, USDA comes through DOE in Massachusetts, and we handle all those federal commodities. And then we also have a very robust state commodity program called MIFAP, which allows us to purchase very high nutrient quality products. Nearly 40 farmers, as an example, participate in that program. And we buy as much local produce and local food that we can. But to remind you, which you may not know, Massachusetts imports 86% of its food. We are not an agrarian state. And when you look at the export green products in Massachusetts, almost the top 10 are things you put in your yard, like a shrub or a bush. It's not a state that produces cranberries at a huge amount, or milk, or apples. It's a state that produces green things that grow in your yard. So it's just an interesting piece. But in Massachusetts, we do collectively SNAP outreach, which we know is important. We also, recently, the Greater Boston Food Bank picked up it's the CSFP program for elders, a very different audience. But for children, there is the Child and Adult Food Program for reimbursements. There's a lot of work with WIC and summer feeding. There are kids' cafes, backpacks, mobile markets. School-based pantries are an emerging model. So these are not like a closet in a school. These are mass distributions to every family in the school. So the good news is we're working with it. The bad news is it only happens once a month. So you help, but you're not actually really eradicating or getting to that critical issue. So many of these programs you know, and they are deeply useful to that family at that time. But again, it's helping with the issue versus solving the issue. And also, the role of the school food service work is just really critical. For many children, that breakfast or that lunch is important. It's why the kids' cafes are highly popular, because those kids are going to Boys and Girls Clubs or Salvation Army or Big Brothers Big Sisters programs in their community, and they're having dinner. So if they are eligible and enrolled, and there's a breakfast program, and they're going to the kids' cafe program, you get them 3 meals. But if they're not, any one of those is a loophole in the process. So just to close out, let's look at the state. So you come from a variety of places in the state. And when you look at the whole state, 1 in 6 are actually living at risk of hunger. So to the left of the slide, you can see the percentages across the Commonwealth. And you can see where some states are better than others, and some counties are better than others. And part of this has much to do with where you live, population, access to food. I don't think food deserts are a dead issue, but we're not talking about them as much as we have in the past. It's interesting that sort of has ticked down in terms of issue, but there are still places in our state where it's very limited in terms of accessing your food. And we all know that our growing season is very limited in terms of 10 growing weeks a year. So again, we're dependent. Food in the United States moves from the west to the east. Okay? California grows 40% of the produce for the United States. So when you get to Massachusetts, there's not too many options for the food to go to, except being frozen or in the ocean. So we have a much higher volume of frozen food in Massachusetts than in many other states. So as we're going to look down and have our experts begin to think more and help us understand what this issue looks like, we wanted just to make sure that you saw this landscape and that we can probably have a more robust discussion at another time as to why this looks this way. But we are deeply aware that by the location of where you are born into in our state, and or the family, and or the resources that are in that community are going to matter significantly in terms of why a child would find themselves at risk of hunger. So I'm going to stop there and give it back to Jennifer to move us forward.